The structure is predominantly male-dominated. That's one thing. At the same time, there are so many cultural beliefs and values which in a way interfere with what we promote. There are so many birthing practices which are associated with the culture. For example, they believe that a woman should deliver. There are some tribes which believe that a woman should deliver in the hut, squatting on a hall. Okay. So there are such beliefs, meaning that the delivery place is not in the bed, it's not in the clinic, but it's in some hall. Number two, there's so much they do with the they literally worship the placenta, some tribes. And there are ritual things they do with the placenta. So for you to take the woman to a facility and she delivers from there and the placenta is thrown away, that is unheard of. Even when it comes to referral and a woman has failed to deliver in the hands of a TBA, the husband will ask the TBA to go with the woman up to the hospital so that she receives first and foremost that placenta. So there are these things which we need to understand and say, okay, how best can we work with that, but at the same time make sure that the delivery is safe. So these are very strong cultural beliefs, and in fact, if you observe in some of the tribes like the Dinkas and you observe what is happening to the placenta, the way they wash it and treat it, and you really see that that's one of the reasons why they cannot go away from the traditional home, because the traditional home provides those facilities for those things to take place. I think they have not moved away from. I think one of what preoccupies their mind is a woman getting pregnant and getting a baby. Okay, so they have not moved away from that to begin to think that a pregnancy is dangerous and needs to be spaced or needs to be delayed or to be stopped. They haven't yet got to that. It's about birth of a child and what a child is and what it brings and how much dowry did you pay, and therefore how much profit and gain do you get out of producing babies. So we have not gone to that stage where they look at child spacing as an issue or determining the size of the family as an issue. Simply because the usual things which would bother somebody would be having enough to eat, having enough health care, and those kinds of things. But they are coming out of a war where they've survived so much with very little that I don't think that they see there anything which would be more abundant yet. But the thing in Sudan which is most crucial is more associated with too early, marrying too early, and getting babies too early, and those complications. That's where the emphasis should be. How do we get to delay the marriages? How do we get to delay early pregnancies? And how do we help people to understand the dangers and the risks of early pregnancies and the childbearing? There are some cultures they practice today which in a way do some family planning for them. Things like having no sex and during breastfeeding period and breastfeeding for 2 years, and then the child gets all it can, but at the same time the woman doesn't get pregnant anyway because there's no sex, which is not good. But that in itself, you can go to certain communities and find that there's no problem with spacing. Naturally, that has to happen. So the churches have so So they are in so much trouble, to the extent that you always have to remind them about their commitment to their congregation in terms of health. And you discuss with them, you invite them to a meeting and discuss about what is your view about women's health. How women should not die. But especially the children. People don't want the children to die. But if you don't want the children to die, then you must have healthier mothers as well. So the church has a long way. They're interested. They've gotten engaged, but they have yet to understand more and more what their role is, and how they could participate fully, or how they could cause some significant movement in the communities for men and women to understand about health, more about their health, and what they can do and what their responsibility is. A typical family first, it's a large family. And how it gets large is probably not because each woman has too many children, but each man has many wives. On average, 33% of the marriages are polygamous, with on average 3 wives. So a family in South Sudan is a family where you find this one man with 3 wives. Okay. At the same time, you'll find that the younger wife, or the more the wives, the younger they are, because of course men desire more younger women as they grow older. So you find the case of very young people married to very old men. So there's a whole issue of cross-generation sex. And this is one of the issues we want to focus on, or we are focusing on, in the HIV/AIDS prevention. Because women in South Sudan take long to see their partners. It can be 1 year, it can be 2 years. So a lot could happen on both sides, whether the side of the man or the side of the woman. So to answer your question about a typical family, the family, you think that some of the people who are there are his children, but actually are his wives. So it's so creepy. It's you have these men, they are proud of having, the more wives you have, the more able you are. So they are able because they pay a lot of dowry. It's not cheap even to marry. In some tribes, it's 100 heads of cattle. So because this marriage is like a communal thing, you know, everybody contributes to everybody's marriage, the whole clan. So it's a typical family is so large, it almost includes everybody, all the brothers and their wives and the wives, and even a brother can discipline a wife if the husband is not around, the wife of a brother. So it's like women are not only married to this one person, they are married to the family. That is one of the things I found very shocking, but they are there, and they are very common, including people who are in key roles within the church. But it is the early pregnancies and the early pregnancies which and how they take care of young mothers, and how they should take care of themselves, and understanding pregnancy and so on and so forth, which are very critical at this point in time, or how should they avoid getting pregnant anyway. We as just have promoted the use of contraceptives, particularly for young people. Young people who are not in school, who are simply labeled as adults because they already have their first child, or they are not in school, but in fact they are young and they need to delay childbearing, because some of them by the age of 20 they already have 4 children. Yeah, so it is how do we assist young people to avoid the unwanted pregnancy, because 6% of some of the conditions that come through the hospitals are associated to abortion, which is illegal. So which means that they're inducing abortions, which means that there is a level of unwanted pregnancies. So we should not assume that everybody loves these pregnancies. They don't like these pregnancies. But because they have nothing to do, they are not informed, they are not aware, other people are not aware. So the whole notion of delaying a pregnancy or using contraceptives is not yet known. This is virgin ground. So we need to do a lot of education and awareness raising about issues of women's status and how they need to begin to make these decisions about their reproductive life, and how they need to begin to delay pregnancies in order to pursue education, pursue better life in the future. So the churches have they are in so much trouble, to the extent that you always have to remind them about their commitment to their congregation in terms of health. And you discuss with them, you invite them to a meeting and discuss about what is your view about women's health. Our women should not die. But especially the children, people don't want the children to die. But if you don't want the children to die, then you must have healthier mothers as well. So the church has a long way. They're interested. They've gotten engaged, but they have yet to understand more and more what their role is, and how they could participate fully, or how they could cause some significant movement in the communities for men and women to understand about health, more about their health, and what they can do and what their responsibility is.